Hi, hope you are all having a good day. I'm Dr. Nandini Gokulchandran, and good morning to those who have just woken up, and good evening to those who are from India, and good afternoon to those who are from UK and other time zones. So I welcome you to this webinar. Um I'm sure a few of you have already seen some of our webinars and attended, uh, but this is something which many parents, professional want to know what can be done for those children with neurological conditions where right now we have only rehabilitation. So what are the new things that can be done? What there are worries in parents' mind, there are doubts. So here I'm attempting to clarify a few things, simplify some of the processes that can help children with autism, cerebral palsy, and intellectual disability. What new is there apart from stem cell therapy, and what more can be done for the children? Uh, so this is NeuroGen Brain and Spine Institute, as many of you would already know, where this is a institute of excellence for neurological conditions, where we have comprehensive treatment for neurological condition, a combination of newer treatments like improving the brain functioning, regeneration, along with neurorehabilitation, along with newer oxygen therapies and integrative therapies. So why are we here? From different time zones, and I'm sure many of you just waking up in the morning on a Saturday, spending time here. Why are we here? We are here because either there is a child who at home who has autism, ID, or cerebral palsy, or we have patients or you are caretakers of children with various disorders, or professionals who deal with children with various neurological disorders, and we are here to find out, what can we do. And so what is happening so far? So far, that once a diagnosis happens, a child is either diagnosed with autism, or somebody tells you that your child has a brain damage, has cerebral palsy, you wonder what can be done. You run from one place to another first to understand the problem, get a diagnosis. You visit therapists, you visit doctors, you go to various clinics, you go to various rehabilitation centers, and you are told that the only thing that is possible is therapy and rehabilitation, and that there is no cure for the condition your child is suffering from, that only rehabilitation is possible. So many people who come to us, many parents who come to us with a lot of discouragement, come with a lot of disillusionment with the system, saying that how is it possible that medical science has gone so far ahead, and still I'm told that nothing can be done for my child. So here we are to understand there are a lot of options, there are a lot of things that you can do for your child to be able for them to lead an independent life, and that's where we would like to give an encouragement, give a positive direction, a positive way ahead of what can be done. So what is new? The old thinking was that once the brain is damaged, it is incapable of regeneration. But now we know, and it's not just yesterday, but almost 15 years plus, the thought has changed, the dogma has changed, that a damaged brain can be regenerated, and the regeneration is possible via cellular replacement and repair. So brain, though it is thought that once the brain is formed, no new cells are formed. However, it is not true. There are niches in the brain which continue to multiply lifelong. So just imagine the brain not regenerating, or new cells not being formed. We will never be able to form new memories. We form memories every second of our life. How is that possible? It's only possible because cells in some part of our brain do multiply, connect, and form new memories. So if certain parts are able to regenerate, why not other? Yes, as compared to other parts of our body, brain, the multiplication and repair in the brain is much slower. However, if it is assisted by the right means, it is possible to regenerate and repair and recover function. The old view was that the only thing possible is the rehabilitation. But the new view is that we have a combination. We can do multiple things. It is a teamwork. So you do have rehabilitation, then you do have stem cell therapy, and you have integrative therapies. All together will help to reverse autism. So, or cerebral palsy. So this combination is what we have found works beautifully. It works as a team. They complement each other, and it is possible to reverse some of the neurological conditions. So you must be wondering, what am I talking about the brain? And suddenly you are on the screen, you find a fractured leg, isn't it? So many of you must have either experienced a fracture sometime in your life, or seen a near and dear one or a friend having a fracture. So what would you do if there's a fracture to your leg? Would you start strengthening your muscle, or starting doing physiotherapy, or start walking immediately? No. What would you do? You would first want to fix the fractured bone. Once you fix the fractured bone, then you start doing the exercise, then the muscles strengthen, and then you can walk. But the healing has to first start. Similarly for the brain. When there is a damage in the brain, you need to repair this damage, and then doing the training, the physiotherapy, the occupational therapy, the speech therapy makes sense, because now when the brain has healed from inside, and now when you push the brain to be able to do the function, you will see better improvement in the function of the child. So that's where we are looking at ways to get out of the wheelchair, ways to convert hopelessness to hope. So there are three parts to this webinar. One is the stem cell therapy, the second is the rehabilitation, and the third is the integrative therapy. Stem cell therapy, like a stem of a tree, when you give proper growth factors, when you give proper fertilizers, gives rise to branches, and then leaves, and then flowers, and then fruits. Similarly, there are cells in our body which multiply many times, make cells similar to their own, and depending on where you put them, if you put them in the heart, they can stimulate heart cells. If you put them in the muscles, they can stimulate the muscles to work better. If you put them in the liver, they can help to improve liver functioning. And similarly, you're looking at the brain, you put them in the vicinity of the brain, can help stimulate the brain to repair. So what do these stem cells do? What actually is the way that they work? One stem cell can multiply into many. You can see different. Multiply into many cells, like the zone. So you can form many clones and many children. So one cell can multiply and become hundreds of cells. It can release lot of positive chemicals. It releases lot of positive chemicals which help in stimulation and repair, neuronal stimulation and repair. Number 3, it helps to produce new blood vessel, new blood supply, new angiogenesis, and thereby increasing oxygenation to the concerned part. Here we are talking about the brain, so improve oxygenation to the brain. And lastly, they can differentiate into neurons, they can differentiate into bone cells, can differentiate into muscle cells. So these are the different mechanisms of actions of stem cells. So through this, they can repair, they can regenerate, and they can replace the damaged tissue. So regenerative medicine basically is repairing of the damaged part, for example, the brain here, with the tools that is a stem cell, and improving the brain function and replacing the damaged cells. So either cells can be taken from your own body and put back in our own body, known as autologous transplantation, or they can be taken from somebody else and put in our body, known as allogenic transplantation. And where do you source the stem cells from? There are different sources, and each has their pros and cons. All of us, before we were born, when we were conceived in our mother's womb, we were one cell stage. And the 1 became 2, 2 became 4, 8, 16, 32. We were a bunch of cells at about 3 to 5 days of conception. This bunch of cells would then differentiate into what is called as the inner cell mass and the outer layer, which would form the placenta. The inner cell mass could be, taken out and multiplied in the laboratory, this would actually give rise to the whole baby or the whole child, and hence has the potential to form each and every cell of our body. And thereby these cells are known as embryonic stem cells. However, there are certain ethical objections to it, because there are faiths which believe that once life comes into once the child is conceived, it has life in it, and then they're using these embryos, even if they are, waste embryos from in vitro fertilization clinics, you're killing a life, or you're taking a life, and hence ethical issues. There are also certain scientific worries about tumorigenicity, tumor formation, which exists only with embryonic stem cells, and hence embryonic stem cells are not to be used for actual medical use. They are good as research tools, however, for treatment purposes, they are still not to be used. The other type of cell that we know commonly of is the cord blood stem cell. So a child and the mother is connected with each other through a cord, and the cord blood is what contains a whole lot of cells, and these cells have good potential, and if they are stored, can be used for blood disorders. Most common indication for use of cord blood is blood So the second types of the cord blood, and the cord blood is a very good source of stem cells. These cells are indicated in blood disorders or hematopoietic disorders, as well as they are now being used in clinical trial for autism and cerebral palsy also. However, if you have not stored the cord blood, what options do you have? You do have the adult stem cells. Adult stem cells are taken from our own body. They are taken from the bone marrow, or they can be taken from fat cells. There are adult stem cells also found in our wisdom tooth, or in children in their milk tooth as well. So these are different types of cells from our own body which are being researched. And the oldest type of adult stem cells which has been researched for a whole lot of years, and first time ever Nobel Prize was awarded, was for bone marrow stem cells. So bone marrow cells are one of the most researched, understood of adult stem cells. The stem cells do not have any ethical issues. We are not killing an embryo, and hence it can be, and they're safe, no tumorigenicity, and can be used for treatment purposes. The fourth type of stem cells that is now being researched is known as induced pluripotent stem cells, or designal stem cells, where adult stem cells like skin cells from our body can be reprogrammed using various techniques of stimulation and can be converted into embryonic stem cells. So without using an embryo, we can get embryonic stem cells from our own body. So that is still being researched and understood, and these stem cells, or hopefully later, will be able to give us solutions for problems such as sickle cell anemia, for retinal degeneration. A lot of work is happening. However, at present, in today's time, for brain conditions, there are few very safe stem cells, and one of them, of course, is the bone marrow. At NeuroGen, we use bone marrow derived stem cells or bone marrow derived mononuclear cells to improve brain function. Why? Because they are safe, they are non-tumorigenic, there are no rejection issues, they are easily obtainable, and there are no ethical issues. So where did this concept of stem cells start from? Is it something which started yesterday? No, if you look at the history of Nobel Prize is one of the most revered awards in the world for various fields of science, literature, economics, technology, and it has been awarded 3 times in the history of this awards for stem cell research. In 1990, demonstration of stem cells in bone marrow was awarded to Dr. Thomas for the first time. Then in 2007, Sir Martin Evans was awarded the Nobel Prize for the isolation of embryonic stem cell in the mice. And then recently in 2012, two scientists, John Gurdon and Shinya Yamanaka, received the Nobel Prize for induced pluripotent stem cells, which is the most recent form of stem cells being studied. So a lot of work has gone for the last 50, 60 years on the evolution of stem cells. And of course, it's still an evolving field, but a lot is now understood. And this is one of my friends who's a liver transplant surgeon tells me that he's going to try and do as many liver transplants as possible in this decade, because soon it's going to happen that stem cells are going to take over and liver transplantation may not be needed. And that is one of the dreams that all of us who are in the field of stem cells and regenerative medicine need to have that dream. So what kind of scientific basis of work do we have at NeuroGen? So whatever is done in NeuroGen, everything is studied and published in scientific journals. Some people tell me, oh, you are published in your journal. No, these are not our journals. These are journals which are national, international journals. These are peer reviewed. What does peer review mean? That we send our work, our data to an external source. There are 2-3 different scientists all over the world who scrutinize what we have done, and if they find it up to the standards for publication, then they're published. In this way, we have about 106, 107 publications in stem cell in various neurological disorder, 16 in autism, 15 in cerebral palsy, 4 in intellectual disability, 18 in muscular dystrophy, 9 in spinal cord injury, 6 in brain stroke, and a whole lot of other neurological conditions. Other point for our credibility is that all the work that we have done, we are now recognized as credible authors to write. We are invited to write book chapters in various international textbooks. For example, we were invited to write a chapter on stem cell therapy in autism spectrum disorders in a book which was for recent advances in autism, published by international publication. Then another one was for cerebral palsy. Again, this book was labeled as Cerebral Palsy Challenges for the Future. And one of the burgeoning treatments is stem cell therapy for cerebral palsy, was also written by us. Another chapter for pediatric neurological disabilities was written in a book known as Physical Therapeutics, Physical Disabilities, Therapeutic Implications. Another chapter in muscular dystrophy. This is Prime Minister Narendra Modi, to whom Professor Alok Sharma is presenting the book that we have written on stem cell therapy in neurological conditions. This book was accepted by the Prime Minister and acknowledged. Prime Minister Narendra Modi is also a big supporter of stem cell research and therapy. He believes that this is a field which will help us give solution to many incurable conditions, including sickle cell anemia. So when he became the Prime Minister, he went to meet Professor Yamanaka, who got Nobel Prize, who received the Nobel Prize for iPSC, induced pluripotent stem cells. He is based in Japan, and there we discussed about using stem cells to treat sickle cell anemia in tribals of Indian native tribals. When he came back to India and started in STEM in Bangalore. So in the parliament, Prime Minister Modi spoke about about the use of stem cells for incurable conditions like sickle cell. So a lot of support from the government as well. So how is this treatment done? Parents feel, okay, we have heard of stem cells, but how is it done? Is it going to cause our child a lot of distress? Is it a big surgery? What is the procedure? So at NeuroGen, the procedure is very simple. It's not a big operation. One needle in the hip bone marrow is aspirated under sedation. From the hip bone is a very good source of stem cells, and bone marrow is multiplying, lifelong till we die. And most of our hollow cells and the ends of our hollow cells. So bone marrow is aspirated, stem cells are separated in the laboratory and injected in the lower back into the spinal fluid. So let us see a video. Here bone marrow is being aspirated. You can see the child is sleeping. Stem cells undergo centrifugation and separation in the laboratory are get counted, viability is tested and injected using a very thin needle. So you can barely see any sign of injection on the body. So having told you about this very simple process, simple, safe and effective, let us see the effect. So let's look at autism. We know what autism is. It is not just about not having speech. When parents come to us, so my child is absolutely fine. The only problem my child has is he cannot speak. But that's not the only problem. A child who cannot hear also cannot speak. However, he can respond to external stimulation. He can, understand what's happening in the world. He will, despite not being able to speak, is able to socialize and communicate by other means. However, a child with autism has difficulty in processing outside information, has difficulty in socialization, is not interested in the outside world, and has very specific, very narrow, repetitive interests. So also that prevents the overall development of the child. It's a neurodevelopmental condition, unlike what was thought earlier to be a psychiatric condition. It is a neurodevelopmental condition. Brain development is affected, and that's something which we know better now. For some reason, occurs more in males than in females, and is detected now early on, between 2 to 2.5 years now. Why do we have to worry about autism? We have to worry because the numbers are increasing. In 2004, the CDC Atlanta data showed the prevalence to be 1 in 166. Now in 2018, it is 1 in 59, and in 2020, it is 1 in 40. So the autism, the number of individuals with autism is increasing, and 1% of the world's population is now estimated to be autistic. 70 million people on the spectrum. So it's I think a much more severe, much more worrisome pandemic than even COVID. So that's something which we need to really understand and try, if possible, to prevent, and if possible to reverse and get these children into mainstream to be able to function as productive individuals in the society. What are the main issues? Poor social interaction, impaired communication, restricted repetitive behaviors, and interest. Now, what do we know new about autism? We understand autism much better because of now imaging, higher advanced imaging techniques. Now, imaging technique that is being used routinely at NeuroGen is a PET-CT scan. So you're all aware very much of a MRI scan. MRI scan is something that, the brain structure. Who is the brain structure? So I tell many people, oh, this is a chair. It has 4 legs. That's what the MRI shows, that, there are 4 legs, they are there. But it doesn't tell us how strong are these legs. If I sit on this chair, will it take my weight? So that's what PET scan tells us. How well are these different parts of the brain functioning? If you see a scan here, which is in multiple colors, you can see this brain slice, which is a side view of the brain. So when you cut the brain like this and see from inside, this is the front of the brain, top of the brain, back and below. This part here, the green, red, and yellows, is good functioning brain, while the blue, the darker the blue, lesser the functioning. So you can see that 2 parts of the brain here are functioning less. This is inside of the brain. This is known as medial temporal region, which contains 2 parts, the hippocampus and the amygdala. And this small brain here, which is jutting out, is the cerebellum, which is part required for fine motor activity, coordination, balance, articulation, and sensory processing. Sensory integration. The part here, the medial temporal, is for understanding, comprehension, learning, cognition, and also for emotional expression and social interaction. And these are the problems which we see in children with autism. So these are the areas we need to improve to make better in terms of functioning for the child to improve. So this baseline study of what is wrong and what is the problem in the brain of a child with autism was published by NeuroGen Brain and Spine Institute in the World Journal of Nuclear Medicine. And to summarize what we understood and what makes a lot of sense is this graph. So when you see the brain functioning or the brain metabolism in a neurotypical, this is the blue graph that you're seeing. So between 0 to 10, the brain metabolism is increasing very fast up till 10, and after 10 to 15 also the brain function is increasing, but maybe not as fast, but it continues to increase. But in children with autism, you can see initially the brain metabolism is high and then it goes down. So what does that mean? That means that as the child grows, the brain functioning is reducing, and you see the increase in the difference between a neurotypical child versus a child with autism. And that's why we believe that early intervention is important to push this graph up towards the normal brain. So this is why early intervention becomes very, very critical, because as we increase in age, the gap increases and more challenging, more difficult to push this graph up. Of course, there is no one arrow which will hit the mark for autism. It is a multifactorial in terms of even its development or the cause, and also the treatment is multidisciplinary. It has to be a combination, something which improves the brain functioning from inside and what trains the brain from outside, and a combination is important. Just as when you go to school, it's not just English or mathematics or science that a child learns. The child has to learn all the subjects to be able to go to the next level. Similarly, a child with autism needs to have a multidisciplinary team working with him to help him achieve maximum functionality. So the neuro rehabilitation part, which I'm going to go quickly over because most of you are well versed with this. Applied behavioral analysis, ABA, very, very popular, basically to help improve, change the behavior, because behavioral issues do become a deterrent for the child's development. And it's important, I believe that not just a therapist should be doing the ABA, but even the parents need to inculcate that at home. Improving a child's behavior helps the child to get away from wrong habits and behavior, and to use his comprehension for better or positive constructive activities. Physical therapy, though, has been given less importance in autism. We find is very important. Motor impairments, those subtle, are important. Many times there is clumsiness. Motor planning is not very good. Tone of the body is low. Even sometimes climbing stairs, gravitational insecurity, all these can be helped by proper physical therapy. Occupational therapy, one of the most important parts of treatment of autism, I feel, and most neglected. Occupational therapy basically teaches a child what he needs to do. What does a child need to do? The child needs to know how to play. So we have occupational therapy teaches how the child should play appropriately. A child needs to be toilet trained. A child needs to know how to brush and wear his clothes and have a bath and eat by himself. And these are the things that occupational therapy will help a child to learn. Sensory integration therapy, also a part of occupational therapy, helps the child to integrate information from outside, whether it be through vision, through ears, through touch, and the various sensory modalities, to integrate appropriately, to be able to respond appropriately. And that's, again, a very important part of a child's treatment. Speech and language therapy. when a child doesn't speak, that's what parents start off with. Yes, it's very important, but even before a child speaks, there are other things that is speech language pathologist needs to work on, that is comprehension, as well as other non-verbal ways of communication has to start first. Aquatic therapy, exercise in water. Children love water, so you can use the water as a medium to improve the child's tone, focus, ability to respond, learning. All of that improves with aquatic therapy. Art-based therapy, children love music, children love dancing. Use it to teach the child appropriate way of dealing with his emotions, as well as learning new activities. Heavy metals is one of the possible causes which has been attributed for development of autism. However, it's not just autism, but all neurodevelopmental disorders at some because of increased pollution in our environment and increased toxins on the mother may be one of the reasons for the brain development to be affected. But studies have shown that when the child is in the mother's womb or in early infancy, that's where the heavy metals are most destructive or cause the most damage. Supplements, nutritional supplements do help the child's integration, his brain to integrate, his nervous system to develop. Diet and nutrition, yes, GFCF diet has been studied a lot, and it has about 50% productivity or efficacy, and children do appear to benefit. About 50% of children do appear to benefit from this diet. Major do's and don'ts is avoid sugars, avoid pesticides, avoid difficult to digest starches. In the child's food, ensure a lot of probiotics and prebiotics. If you can, do inculcate gluten-free, casein-free diet, vitamin-rich food, and again, as I said, avoid sugars. The results, overall 90% success rate is what we see in autism with stem cell therapy and rehabilitation, the combination. 10% children do not show any improvement or very mild improvements. What do we generally see? We see improvement in reduction in hyperactivity, improvement in sensory issues, better communication, better eye contact, attention and focus improves. Most startlingly is comprehension. The child learns faster, grasping power improves, the awareness about surrounding becomes better, empathy improves, and eventually communication and speech, definitely. The first ever scientific publication which showed that stem cell therapy has a role in autism came from NeuroGen Brain and Spine Institute way back in 2013, where apart from clinical improvement, we also showed that brain functioning improves. So this is a PET scan before the treatment, where you can see blue, black areas. These areas indicate low functioning brain. It does not mean that brain cells are dead. They just mean these cells are less active. So before the treatment, 6 months later, you can see that the blue is much less and the green is more. So green indicates green, yellow, red indicates good functioning brain. You can see the blue improving and blue becoming green. That means the brain is improving. The second article, which came from NeuroGen very recently in 2020, was published in the American Journal of Stem Cells. And this was a larger study of about 254 patients. To summarize, we studied various symptoms. We found, as such, a social interaction improvement in more than 50%. Again, eye contact improving in more than 50% of children. Attention concentration improving in almost 75% of the children. Stereotypical behavior becoming lesser than 50%. Aggressiveness reducing. Hyperactivity reducing. Self-injurious behavior reducing. Sitting tolerance improve in almost all children. Command following improve. The speech improve in more than 50%, and communication. So holistic improvement is seen in children over a period of 3 to 6 months. Clinical assessment scores also have shown significant improvement. We find that all kinds of severity stem cell therapy helps. And most important message in this paper was that less than 5 years, children with less than 5 years do the best. So lesser the age, better the results. So children come to us now as early as 2.5, even before they are diagnosed, and only red flag. And almost 98% is the success rate. Between 5 to 10 years, it's about 94%. And between 10 to 15 years and more, percentage goes down. So as the brain becomes more and more mature, the possibility of success becomes slightly lesser. Both males and females have good improvement possibilities, and earlier you come after diagnosis, better the results. Isn't that so for any condition? So if children come to us within a year of their being diagnosed, the results is almost 100%. If they come between 1 to 5 years, it's about 95%, and if they come later than 5 years, about 90%. So in terms of evidence, now people ask us evidence, it's still experimental, but there's so much evidence. Just look here. First publication from India in 2013, second from China, third from Italy, fourth and fifth from US, one of them being the Duke University publication, sixth again from India, seventh from Vietnam, eighth from Iran, and ninth from the US. So there is enough evidence, enough data now to look at for parents to look, and even professionals to look at. From NeuroGen, about 16 publications. Let us see a few examples. I think many of these examples you must have already seen, but maybe I can, help you understand them better. So this is a child from the US. He came to us when he was 10 years old. He's now 17, about 16, 17 years old now, from Kentucky. Almost a 4 years jump in 5 months. Isn't that amazing? Look at his grades, all A, and highest GPA. His autism reversed, his speech is near normal, he now can speak English, Spanish, shifted to a normal school, got A grades. And the most recent update is that he got, appreciation award for being part of a choir. So, singing. So isn't that amazing? This is the story of triplets now. Extremely hyper, very, very severe when they came to us. Video is not being seen.
No, video is still voice.
So I understand that you're not able to listen to what. So let me describe to you. So these are triplets from. These are triplets from. These are triplets from Kenya, and they came to us when they were 6 years old. Now they are 10 years old, and I can tell you that these children have improved beautifully. I wish you can come to NeuroGen right now. They are here, and I can tell Rick, this 1 year is now out of autism. Maybe has a little bit of attention deficit. That's all, and he can communicate. He can talk to you. Like we can have a proper conversation with him. So Rick is almost out of autism now. Almost he's out of autism now, and he's learning the piano. He now plays the national anthem of India, not Kenya, of India. That he did that in the autism day. The other two brothers, one who is moderate is now mild, is able to vocalize, is able to speak on demand, and is a beautiful swimmer. The third one was very, very severe, is now much more calmer, though he still doesn't have words. So, I think, so this is Mercy's triplet story. I think many of you would have heard it. So I understand the voice is not going through for some reason, and I apologize for that. So I'm going to go ahead now, and so this is again another child from. I'm just going to try and figure out if. So this is child. This is a child from Kenya who came to us when he was 13 years old. Extremely violent, aggressive, very, very difficult to manage, would run out of the house. In fact, he was not taken out of the house, never went to a special school before the age of 13. He came to us after the stem cell therapy. He's calmed down so much. He's able to do his own activities. He's completely toilet trained now. He now goes to a special school. He's able to ride a bike, and he's able to do swimming, and he's come a long way from what he was before. So we find that, but if this child would have come to us earlier, he would have been much, much better. So this is child from South Africa again. When he came to us, he was 4 years old, and then second, when he came to us, he was almost 5 years. I wanted to make you listen to his speech. He was non-verbal when he came to us. I'm not sure whether you can hear it. I'm going to give it an attempt. So before he had, you can see he was no command following, totally uninterested. See how he was before. Slowly became better after 9 months. The first time when he came, his vocalization increased. Earlier he was extremely, hyperactive. It was very difficult to make him sit. And Zach is now 7, 8 years old, and he's completely verbal now. His reading is better than his peers, and he is able to make like a 3-minute video. He does a self-video recording of stories which he makes up by himself. So you can see parents before and now. I will show you his video. I'm not sure whether you can hear it, but he's making his own stories. And this is Lemon. Zachary's mother sent me a message out of the blue in November 2020. And now he is, telling a 3-minute story on his own without any prompting. So basically, from this, what do we understand, and what we have learned from treating so many children with autism is that yes, stem cell is a good step to help the child's foundation to be made solid. You may not see every result that you are expecting immediately, but it has a long-term impact. People, in fact, ask me, does this effect last for long? I say not only does it last for long, the impact is long. So if we are able to do two stem cell over a period of a year, then we are able to get long-term impact, because now the brain is solid from inside, and now you teach, now you challenge, now you pull, now you push, and the child will respond. So almost 90% of the times we have seen that this does happen. Now let's look at cerebral palsy, where the brain damage is more intense. This is because of very obvious oxygen deprivation, or cord around the neck, or if there is severe seizure or brain development is affected in the womb. The problem can be before, during, after pregnancy, and there are different types of cerebral palsy based on where the damage is, and the damage will be as severe as this. I mean, big chunk of the brain may be really dead. So what is dead cannot be really revived, but what is functioning less, the light blue areas that you see, is what will be salvaged. So this is very important to understand the difference between a cerebral palsy brain and an autism brain. Yes, there are medications to help the convulsions. There are medications to help reduce the spasticity and maybe reduce the uncontrollable movements, Botox to at the local site of the muscles to reduce spasticity. But all of this is from outside. There are some very radical surgeries that can be done, the rhizotomies, which can cut the nerve roots to reduce the tightness, or there can be a hamstring release. But these are all very temporary measures. They really do not address the problem in the brain, which stem cell is able to do. So the results for cerebral palsy, again, is almost 90% of the time we see improvement, at least in some functions of the body. Here we are not looking at 100% the child being absolutely fine, but yes, looking at improvement in terms of functioning and the child's ability to hold neck better, sit better, stand better, walk better, and go to school. What are we seeing? This is what we see. See, what we see is from neck to down, or head top to down. So first is improvement in understanding cognition. Okay, improvement in better eye focusing, improvement in oromotor, tongue movement, lip movement, swallowing, better neck control. Now, when this happens, better neck control, then you are able to make the child sit better, then the trunk control, then the standing, then core muscle strengthening, then the walking and hand functions. So this is how the improvements are seen. You can see the brain here. You can see before the treatment, this blue and black areas are functioning less or damaged. The black is damaged. The blue is functioning less. The black will not disappear because there is nothing there. There are no cells there, and it's just scar tissue. But the blue in between the black is now salvaged. The blue is becoming green. Green means better functioning brain. So let us see a few more examples of the PET scan here. I want to show you something. Yes, right here. So you can see the blue parts here. This is before the treatment, and you can see that it is now becoming green. Okay, the blue here is now becoming green. The blue you can see here, vision area, is now becoming green. So again, this is from a publication. We have multiple publication against cerebral palsy, and let us look at the improvement videos. This is a PET scan of a child who came to us completely quadriplegic, and you can see his treatment started in 2016 and went up till 2019 and 20. And you can see here the brain, only half of the brain is visible, the lower half is not there. And this is 16 and C19. You can see that the brain is developing, the brain functioning is improving, and that's something amazing. So this is the video of that child. You can see completely quadriplegic, no hardly any neck control before the treatment, so tight and stiff. You can see after the treatment, slowly his neck control, pulling up his neck improved, then trunk control improved, sitting balance improved. You can see here completely no balance. Now he could sit better, he was able to use his hands better. So first the neck control, then the balance, and of course rehabilitation had to continue. You can see standing with much better trunk control. Then to make them stand with holding the trunk and moving the legs, passive movements of the legs first, and then the child with support start walking. So these are the steps that we need to take for a child with cerebral palsy. It is a journey. It takes a lot of hard work, but somewhere in the hard work becomes more productive when the brain starts functioning better. This is another child from Kenya, 7-year-old, who needed complete support. You can see here to stand. So he had only sitting. So you can see here, first we had to make him stand on a standing frame, and then we made him walk with the walker. And now you can see he's walking without support. So this is at home now. He's walking on rough surface and uncontrolled or unsupervised. He's able to walk much better. So at the age of 7, also we are able to get him to walk independently. This is a child who came to us when he was 14 years old. You know, he was spastic quadriplegic CP, was on wheelchair when he came to us, and then slowly you can see even his upper body balance was not so good. We taught him how to wear his clothes, how to pack his bag. He was going cognitively, he was good. He was going to a regular school. He was in 8th grade at that time, and small things which we take for granted, like even opening the bottle, was not possible from him. Now he's independent, and now you can see from a wheelchair he's walking. So this is what over a period of 2 years that Alex has been able to achieve. This is a child from India. Now you can see earlier he had ataxic CP. So this is where the small brain is affected. Severe balance issues, speech, even articulation is affected. Focus is difficult. So this child had a lot of difficulty before the treatment, and you can see standing improved, climbing stairs finally achieved. Going to school now. So we achieved first ability to get up from floor, sitting on the chair, climb up the windowsill, then first walk with AFO, then slowly the AFO, going to shoes, speaking, climbing stairs. Though still a little bit ataxic, but he's come a long way. With constant care, treatments, multiple treatments. He's able to now speak, articulate, write, eat his own food, go to school. That's eventually our aim, that a child should be able to go to school. Stepping without support, work on hand function, eye coordination, pencil grasp, so that he can write. So every aspect of the child's development is important, not just walking. We have to look at cognition, we have to look at speech, we have to look at hand function, activities of daily living, everything. So eating by himself, that's what you want your child to be completely independent, isn't it, eventually? Wearing his own pants, wearing shirts with minimal support. He's identifying the animals. There are many such examples. I'll go to intellectual disability quickly and wrap it up. So intellectual disability, again, part of the spectrum of neurodevelopmental disorder, where main issue is cognitive abilities is affected. And again, PET scan, you can see blue areas are affected, and 85% is the success rate in intellectual disability. You see improvement in all aspects: cognition, memory, problem solving, understanding relations, social inhibition, toilet cleaning. Brain functioning, you can see the blue areas are becoming green. So brain functioning is also improving. Again, first in the world, NeuroGen is the first in the world to publish proof of concept paper, open label proof of concept study on use of autologous stem cells for intellectual disability. Brain functioning, just see how the brain was before. Completely blue, it looked as if sometimes you feel it looks as if the brain has been chewed by a mouse. So, you can see functioning is very low, and after the treatment, you can see functioning improve beautifully. So these are publications, so scientific evidence. Let's look at one video. I just love this story because this is something very close to my heart. When Pratibha came to us, she was 26 years old. Her name is Pratibha. Pratibha, as you all know, means talent. And very rightly, after the treatment, many things improved. Her cognition improved, her hand function improved, ability to copy improved. Woman child, you can say, started performing sitar in front of big audiences. Cooking. They started cooking beautifully, and this is Sanjeev Kapoor, the celebrity chef, who was judging the competition. So she came a long way, and we believe that if we start younger, we are able to achieve much more as the individual grows. Down syndrome. Again, Down syndrome is also a neurodevelopmental condition. However, yes, it is syndromic. It is linked to the chromosome 21 being, overactive, or there are 3 chromosomes, 3 instead of a pair, 1 extra chromosome. And apart from brain development, there are a lot of other issues, cardiac and thyroid issues, as well as the bone development, sometimes hernia. And so the other medical and surgical issues have to be treated first before we can get the brain functioning improved. And brain functioning, though we can't really cure this condition, we can improve the cognitive functioning of these children. So you can see the brain functioning improve. Again, this is Khushi, who came to us when she was 12 years old, already going to school, having a special educator. However, not only cognitive, but also physical motor skills were affected. Muscle tone was low. Tongue movement was not appropriate. Cognitively, of course, she was much behind. After stem cell and proper continued therapy training, the same teacher who used to teach her before realized that she is able to now learn things faster. She's able to speak much more clearly. She's able to do motor functions better. She's able to dance now, which requires a lot of coordinated functioning of the brain as well as the body. So this child, I have personally tracked her, seen her at her home ground, and she's done beautifully. Earlier you can see speech was not clear. I'm not sure whether you can here she's trying to say 5, which is not clear, and then here she is able to speak numbers more clearly. I'm not sure how that technically, whether you're able to hear this or not. Okay, I understand that you cannot. I'm sorry about this. So that was about the Down syndrome. So of course, parents want to know. It's the first thing before even effectiveness, they ask what are the complications, what are the side effects. So we have to be able to differentiate what type of stem cells we are using. And with autologous cells, there are no major complications, no reversal of neurological function. However, we do see a possibility of a 3% seizure increase in those who already have a history of seizure and or those whose EEG is abnormal. A spinal headache is a real possibility in about 10% of children or even adults treated with stem cell therapy because of the procedure. So this is more because of the dehydration or because of low pressure in the neck and the head, causing a pain where the child, when he or she sits up, has a headache, when lies down, feels better. And this is self-limiting. In 3 to 4 days with fluids, it becomes all right. Temporary pain in the back or pain at the site of aspiration may be there and can be covered or treated with painkillers. Integrative therapies, oxygen therapy. People ask me, what is oxygen therapy? Is it, just taking oxygen? So oxygen therapy, basically here they're looking at improving oxygen infusion in our body by different means. One is by increasing pressure at which the oxygen is delivered in our body. So there are pressurized chambers where 100% oxygen is delivered at higher pressure, as you will see here, this. And the child breathes this 100% oxygen with slowly increased pressure. So the whole plasma is infused with oxygen. Here you can see at normal pressure, only the red blood cells carry the oxygen. Here you can see, apart from red blood cells, even the plasma is carrying the oxygen from top to bottom, from head to toe, and that's why there is increased immunity, better immunity, stimulation of oxygenation, which helps healing, improves the metabolism, increases energy levels, reduces fatigue, and stimulates stem cell also, which we have injected. The other way of increasing oxygenation in our body is through ozone therapy. Medical ozone is basically O2 converted to O3, which is a very active molecule for activated oxygen, and a mixture of ozone and oxygen is delivered through various means, through the ears, through the rectum, sometimes in adults through intravenous drip. And what it does, it helps kills the local bacteria as well as systemic bacteria, fungus. Basically, it's a germicidal, a natural germicidal. Reduces inflammation in different parts of our body, not only the brain. It reduces clots, thins out the blood, so more blood flow in different parts of the body, has an antioxidant effect and also a stimulant of stem cells. So these are natural methods, and of course we also have deep tissue mobilization, which increases the blood flow at different points by acupressure. Colon hydrotherapy is for adults, not for children. The cleansing part in children can be done by ozone as well as by enema. This colon hydrotherapy is more for adults. Mobilization or acupressure or deep tissue mobilization, the principle is that pressure applied at different points induces a state of relaxation, also increases oxygenation in our body. This relieves muscle tension and acts as soothing. Many children love it. And of course, supplementation of vitamins for adults intravenously, for children orally. So this is NeuroGen Brain and Spine Institute, where a combination of holistic approach for treatment of neurological conditions. 12,000 patients treated from 75 different countries so far. This is the core group: Dr. Alok Sharma, myself, Dr. Jacob, Dr. Prerna, and Dr. Nandini. This is our infrastructure, where NeuroGen is based very near a beautiful lake, and very beautiful during rainy season. This is our in-house operation theater, just next to the stem cell laboratory, all connected together. Nothing goes out of this complex, not the building, but not even this floor of this operation theater, stem cell laboratory complex. These are our stay facilities. Comprehensive rehabilitation under one roof. Teamwork, very important. We believe a teamwork is important. Many people initially when they come say, oh, our child is already undergoing therapy, why should we don't need it. But I suggest to them, I recommend very strongly, be here for a few days, understand how a comprehensive treatment together can help. Maybe you will learn more about your child, what the child's potential is. Maybe you will learn a little bit how to push your child more. It's important to challenge the child to be able to be the best person he or she can be. Of course, we have neurologist, pediatrician on board, and apart from all the neuro rehabilitation team. So combination, as we say. So just as stem cells is important, so are the fertilizers and blood and the water. So the rehabilitation and the integrative therapy act as the growth factors for the stem. So that's why the combination, they work, complement each other. Stem cell stimulates the effect of rehabilitation. Rehabilitation stimulates the stem cell, helps them to go where they need to go. So people generally ask me, how do stem cells know where to go? The stem cells have a homing instinct. They are like blank slates. Okay, you can divert them where you want by rehabilitation, as well as the inflammation in the brain will attract these cells towards them. You can write what you want on a blank slate. So training, rehabilitation is very, very important for directing the cells to the right place. This is our rehab setup, the physiotherapy, occupational therapy, our Autism Child Development Center, spinal cord injury walking tract. This is for adult patients, spinal cord injury, muscular dystrophy patients, sensory integration therapy, occupational therapy, speech therapy, special education, art-based therapy. All the books that we have written, freely available online. All our publications as well available online for accreditation, GLP, GMP, and ISO certification. Our awards for Best Stem Cell as well as European Award for Best Stem Cell Center. So how do you reach us? You can reach us through our website, reach us through email. We will try to respond as soon as we can and set up appointments with our doctors. Each patient is appointed a specific coordinator who will help you through the process as well as logistics. There are two types of programs, 1 week and 2 week. 1 week starts again on a Sunday. You arrive Sunday and Monday undergo blood workup, evaluations, pre-treatment or priming for the bone marrow aspiration, brain scans. Tuesday is actual stem cell procedure, and Wednesday to Saturday is a rehabilitation. Then there is a 2-week program where again you arrive on Sunday, Monday, Tuesday is the same, but from Wednesday onwards, along with rehabilitation, you also undergo oxygen therapies and the integrative therapy, and you discharge the next Saturday. So what's different about NeuroGen? Why should you come to NeuroGen? Because NeuroGen has the largest number of scientific publications in the world on neurological conditions. We are focused only on neurological conditions, and that's why we are different. We have written book chapters in various international books. We are the only stem cell therapy center that in the world that exclusively treats neurological conditions. We only use autologous stem cells, which are safe, and we inject them intrathecally so that they reach the brain directly. They do not get diluted in various other organs like lungs or livers or the liver. Stem cell treatment, along with stem cell, there's comprehensive rehabilitation. We have treated over 12,000 patients from 75 different countries in the last 14 years. We have a combination of very senior experienced professional along with newer, bright, enthusiastic blood as well. We are constantly researching, evolving our treatments, looking at what new can be done for our patients and children. And our work is approved by an institutional committee, institutional ethics committee, which is monitored by the approved by the government CPSC. So in conclusion, adult stem cell therapy for neurological condition is safe and effective, and it is a good option when no other definitive treatment options are available. So this acts as a ray of hope. The combination we find works beautifully. It is important to have a holistic approach, and so President Obama is saying that conditions to regenerate a severed spinal cord and let someone from a wheelchair to spur insulin production and spirituality from lifetime of needles, to treat Parkinson's, cancers, heart disease, and others. So Philippines and people who love them. Today, the executive order and the sign bring the change that so many and researchers and innovators, patients and loved ones fought for past 8 years by not federal funding, promising stem cell research. So why is this particular speech so important? Because if you see, he refers to 8 years back. Thus, giving substance to hope. Those many bedside prayers gave and words like incurable from vocabulary. So that's what we are looking at to retire this word unreadable from the vocabulary as far as neurodevelopmental conditions are referred to. So this particular speech is very important because people want to know why this treatment is not done in the US, because way back in 2001, George Bush stopped federal funding for embryonic stem cell research on religious grounds. And when President Obama came back into power, the first thing that he did was he reversed this ban. For 8 years, stem cell research went back in terms of time, or underwent a major setback in the US. And during that time, rest of the world, especially the East, started looking at other ethical options. And that's where adult stem cells became a very promising field, because there are no ethical issues, there are no long-term side effects. We circumvent any objections in terms which are associated with embryonic stem cells. So thank you for patient sharing. I hope this has been an informative webinar for you, and I will be now taking questions which have been put up here. Please do feel free to reach us on this email ID. So I'll be going through the questions. Mr. Pawan Kumar is asking whether periventricular leukomalacia can be cured with stem cell therapy, and whether changes in white matter can be addressed with stem cell therapy. So periventricular leukomalacia generally is related to hypoxia, hypoxic insult. So periventricular leukomalacia is a change seen in the brain following lack of oxygen. If it happens at the time of birth, it's called as cerebral palsy. If it happens later in life due to any other cause, it is hypoxic injury. So yes, an individual or patient with periventricular leukomalacia can be treated with stem cell therapy. Whether he will be completely cured depends on the extent of the damage, but definitely can be helped. White matter changes, again, whether the white matter changes are because of lack of oxygen or whether these are neurodegenerative conditions, are important to understand. So please do send us more information about the patient you are referring to, and we would be able to help you more. What is a good age to do stem cell therapy for children with autism? Earlier the better. We believe less than 5 years is the best age. We find when children come to us between 2.5 to 5 years, they do beautifully. Whether genetic issues can be cured with stem cell therapy. Again, see, genetic issues causing static conditions like neurodevelopmental condition, which are static, yes, can be treated. However, if they are neurodegenerative like leukodystrophy, we may be able to help a little bit, may not be able to help too much. So again, it depends on what kind of condition are we referring to. Can you please share an autism example from Indian parent? I cannot share. We have lots of these examples from Indian parents as well. Sorry, I think I jumped the question. In fact, there's a child whom we treated who is now completely all right. There are, we will send you some certain links of Indian parents as well. Yes. Can I have the links to journal research, Mr. Babu Kumar? Yes, definitely. We will send you the research papers, but they're also available on our website for your free perusal. Will stem cell therapy work for a 17-year-old boy? Yes, it is possible to help a 17-year-old boy, but again, we need to understand what is the condition. So yes, it is possible to help. What medications are available for ADHD? For ADHD, medications available are Inspiral, methylphenidate, and they come as different names like Concerta or Inspiral or Ritalin. What is the cost, approximate duration? I've covered about the duration. So the cost will be, we will need to understand the individual's condition, and then we'll be able to give you logistics and costing. We will reach out to you and we can have a one-on-one. MRI scan harmful for autistic children? No, MRI scan is not harmful. Our child is 5 years old and first MRI was done in 2. Now we further want to analyze the brain. One of the doctors in India suggested not to go to MRI as rays can have adverse effects on. No, absolutely not. MRI scan can be done again, no issues. Plus, along with that, we can do PET scan to understand the functioning of the brain. MRI broadly in a child with autism most often is normal. There are a few times when you do see a few abnormalities. So doing MRI once or twice is not going to have any negative effect. Mr. Chindal, do not worry. Taken 2 shots of still no speech. Kindly reach out. Could you send us a separate message and we will try and understand what has happened. Apart from speech, of cognition, understanding, other socialization has improved, and then we can help the speech come out. What causes Down syndrome, Mr. David Clark? So Down syndrome, generally earlier it was thought that it happens more in older females who are conceiving later after 35 years. So the ovary may have undergone, the oocytes may have undergone some mutation now, but we are seeing Down syndrome in early in 20-25-year-old mothers also. Down syndrome, the exact cause is known, but what happens is known. The number 21 chromosome, instead of being 2, is 3. So to explain to you why chromosomal and genetic conditions happen is, let me give you a very small, what do you say, a screenshot of what happens in our body. So when our body is being formed, initially, as I told you, we are 1 cell stage. And then 1 cell becomes 2, 2 becomes 4, 4 becomes 8, 32. And then from this bunch of cells, we continue to multiply. In 9 months, the whole child is born. So there are so many multiplications happening to form different organs. During this multiplication, there can be mistakes in the multiplication known as mutation. It is a normal part of multiplication. So every 10 raised to the power 6. So that would be every 10 lakh multiplication of cell, 1 mutation may be acquired. And this mutation gets repaired by itself as a part of a normal repair mechanism in our body. Sometimes it may happen that this mistake in the spelling or mistake or mutation may not get repaired, and thereby leading to genetic conditions. Sometimes even cancer could be attributed to this mutation, and even muscular dystrophies, and there are so many different conditions which happen de novo. So this could be one of this. So toxins, pollution, a lot of adulteration in the environment is causing a lot of mutations in our body these days. I'm not sure if I've answered your questions and you've got your answer. Please do continue to put your questions, and there was some. This David Clark, you have Asperger's. Will stem cell therapy work? Sorry, people have put questions in the chat also, so I'm going through them. What does y-axis in these charts mean? X and Y. X-axis is the age, and y-axis is the metabolism of the brain, the quantification of metabolism. That's what the y-axis meant. I'm sorry about the loss of audio. I'm not sure what happened. What is good age to do? As I said, between 2.5 to 5. MRI scan is not harmful, no. How long it takes for someone to see gains after stem cell? At least 3 to 6 months. It takes at least 3 to 6 months to see gains. What are the stem cell tests to be done before and after the stem cell to know it is benefited? So we do PET scan before, and we do clinical assessment, and after 6 months we will do scan again to see whether the brain is improving. And how long is the treatment, stem cell and other oxygen therapy? I think I have told you about the process of the treatment. 2 weeks. In 2 weeks, we have 10 sessions of oxygen therapy. And if it is possible for you to continue, you can continue up to 40 sessions of oxygen therapy back at home. But at least 10 sessions of oxygen therapy after stem cell therapy will give us cellular changes. As we are taking stem cells from bone marrow, will it cause any loss of walking or paralysis in the body? Absolutely not. Bone marrow is a replenishable source of blood cells and gets replenished, and we are taking it from the bone using a very thin needle. No part of your nerve or your muscle is damaged because of bone marrow aspiration. What is the price? Yes, we will be reaching out to you and giving you all other logistic information. At this point, I'm taking only medical questions. Dr. Sugandha, thank you for your appreciation. Thank you, Leena Deshpande, for your appreciation. Dev Kumar, my son is 8.4. Major trouble is of verbal issue. He doesn't speak. He laughs, eats, sleep, digests, listen well, eats food on time. He digests them. First major speaking and expression. He speaks by time. Mr. Dev Kumar, again, a child with autism. It may not just be speech. It could be there would be other issues, comprehension and also socialization. We need to understand that before a child would speak. We need to understand the holistic issue. Children with autism, many have sensory issues. They may not be able to process information appropriately also. And could have apraxia as well. Can it introduce seizures in children who don't have any seizures? About seizures, what we have understood is that in a normal population, 1 to 2% of normal population, even you and me can have seizures anytime in our lifetime. So in the normal population, the percentage is 1 to 2. In individuals with autism, the percentage is 20%. So 20% of individuals with autism have been found to have seizures anytime in their lifetime. After stem cell, those who have a history of seizures or if EEG is abnormal, there is a 3 to 6% chance that yes, stem cell may trigger seizures in those individuals who have a predisposition. Those who have never had seizures or whose EEG is normal, we see the possibility is 0.001%. That means out of the 4,500 individuals that we have treated, maybe 4 would have had seizures without any predisposition. So it is there, but very small percentage. Gene mutation in baby, however, father and mother are asymptomatic. Yes. So if you have done gene mutation in baby, and have you checked gene mutation in father and mother whether they are carriers? So father and mother could be carriers, and thereby the combination would have caused the mutation in baby. Mr. Pawan Kumar, let us connect, and I will understand your child's problem much more in detail, and be able to give you a proper definitive answer. Sarla says, my daughter is 6 years old. She has global developmental delay. She hasn't started talking even a single word. She keeps staring at us but does not repeat or do anything. Will stem cell help? Yes, we should be able to help your daughter, Sarla. Even before speaking, I recommend parents, I know it is important that a child speaks, but also comprehension needs to improve, understanding needs to improve, awareness about surrounding needs to improve. So all that is very important before even a child utters a word. We have seen children who do verbalize, who do vocalize, who have potential to speak, but without comprehension. So when words come without comprehension, it becomes irrelevant. So let's, I believe we should go stepwise in the right way. Yes, Dr. Sugandha, we will share our publications with you. Will stem cell therapy work permanently or will have to do multiple times? Whatever improvement you get with stem cell therapy will remain. Multiple times is done only to boost the effect of the previous time. So when we do multiple time, every time the improvement continues to increase. So it's not, especially in static conditions like autism or cerebral palsy. But yes, if you have a degenerative condition like muscular dystrophy, we have to do multiple times to be able to keep the condition under control to prevent further deterioration. So in every condition, the purpose of doing multiple times is different. Shashank Dhar is asking, my kid is nearing 4 years, non-verbal, zero social skill, high sensory issue. Will your team analyze him first from video meeting or directly we need to visit Mumbai Center? We can definitely first do the assessment on video, and then we can decide about the treatment for him. Thank you, David Clark, for your appreciation. Santosh Shri, it's not that in US it is not approved. In Duke University they are doing. Mexico, Panama they are doing. In India, as I told you, there are different type of stem cells, and use of stem cells from our own body comes under the purview of an institutional ethics committee, which is registered under the DCGI or CDSCO. So there are different guidelines for different kind of stem cells. Minimally manipulated and autologous from your own body, using in your own body, comes under different guidelines, while those where we take cells from others and multiply outside, they come under different guidelines. Oh, Dr. Sugandha, that's so nice of you. Let us do connect, offline, and we will definitely discuss how we can work together. So nice of you to be part of the webinar. Thank you, Mr. Jindal, for your appreciation. Sarla says 6-year non-verbal, she doesn't respond. So as you said, first response has to come, first understanding has to come. And yes, we can help your child. Sarla, we should start. I feel she's already 6 years old. We need to do an intervention as soon as possible. David Clark, how long is your treatment? We have a 1-week program and a 2-week program, as I mentioned. So Dev Kumar, yes, I hope so too, that your child will have good results. We will all work towards it together. Sarla, there is no branch in Tamil Nadu for treatment. Tamil pesuven. There are many people here who will speak Tamil. So I think that's a short trip from Tamil Nadu to Mumbai, isn't it? People come from all over, 24 hours. If you are in India, I think coming to Mumbai is not going to be a lot of difficulty. Ganendra Mishra, possible to do a video assessment to decide whether child needs stem cell therapy or not in consult. So we can do a virtual consultation and decide about requirement of stem cell therapy for your child. Yes, we can do that. Thank you everyone for being for the active discussion. It's always a delight when parents ask questions. The more questions you ask, the more I feel, time well spent. Thank you, Shashank, and hope to help you soon. I hope to help all your children and do correct. Thank you. Santoshi, how long it will take appointment? Right now we are, I think, 3 months ahead. Vira, 16 years old, autism, comprehension, social interaction problem. It will help improve comprehension. Yes, we can evaluate your child. Narayana, 7 years old, ADHD, non-verbal. Yes, I think we should be able to help your child too, Narayana. So we will reach out to you, and we will, my juniors and myself, we will connect with you, and we will individually take ahead your queries. Devilka, adios, and yes, see you in the next session. And if you need our help, and if you have reached us, I hope we have been able to help you. Thank you, PC. Thank you, Pawan Kumar. All of you have a great weekend, and we will talk more later. Thank you so much.